What is a sentinel lymph node in relation to breast cancer? One of the ways to assess if breast cancer has spread is to evaluate the axillary lymph nodes. What are these? Axillary lymph nodes can be said to be stations along the lymphatic channels of the breast, which are pathways that drain fluid from within the breast. This fluid flows out in minute amounts from the small blood vessels called capillaries to nourish tissue and cells. Having served its function, it is then collected in the lymphatic channels and returned into the blood vessels. Invasive breast cancer cells may develop discohesive properties, detach from the surrounding cells, and be transported through the lymphatic channels into lymph nodes. Lymph nodes are part of the immune system, and this path is intended to trigger a protective mechanism if foreign material is encountered. However, cancer cells often develop mechanisms to evade the body's self-defense system. To understand how best to treat the disease, doctors need to know if there is spread to the lymph nodes. This would help us provide the correct level of treatment. Through robust research, surgeons have devised a way to identify the first lymph node in the axilla expected to be affected if there is spread. The axilla is the region under the armpit. This first lymph node is referred to as the sentinel lymph node, analogous to a sentry or a soldier on guard. There are several methods to identify the sentinel node, and your surgeon may use one or two of these in combination. As the information in this short video is intended solely for patient education, it is important for you to ask your surgeon how he or she intends to perform this procedure. In this example, the blue dye method is used to identify the sentinel lymph node. The dye is injected around the cancer, usually after the patient is under anesthesia and just before making any incision. A gentle massage of the site of injection is performed for 5 minutes to encourage flow along the channels to the sentinel node. Having done the massage, depending on how the surgeon has planned the operation, an incision is made. When blue dye is used after identification, the sentinel lymph node that is stained bluish looks like this. If a separate incision is made under the armpit, the scar may look like this immediately after surgery is complete. Sentinel lymph node biopsy was developed as a way to assess cancer spread without causing too much morbidity. At present, there is research on how this may be further de-escalated safely, so there may come a time when fewer women will require axillary nodal staging, especially if they have early breast cancer. Stay tuned to this channel for more information as research data emerges. There is much more content on breast cancer surgery in this channel, and I hope you can join me as I share information in the other videos too. Don't forget to like, share, comment, and subscribe. Until we come together again, take care.